Patients frequently ask about post-operative instructions, and we provide them with written instructions. Everything is on the website, but the gist of it is you want to take care of yourself post-operatively. You should be able to wash your face with gentle soap within 24 hours after surgery. I typically use absorbable sutures, so you don't need to come back to specifically have sutures removed, although we typically trim the tails at your first post-operative appointment. Keep your head elevated because lymphatic drainage is always toward the heart, and that will help prevent dependent edema or swelling. Cold compresses are a gift for the first 3-4 days. As much as possible, either wet and cold, or you can get frozen peas or something like that and wrap it and put it over your eyelids. It's important not to have it too cold. You don't want to get frost bites, but it's very important to have the cold compresses about 5 to 10 minutes every 1 to 2 hours for the first 3 days. Once you're done with the first 3 days of cold compresses, you can typically start to alternate warm and cold compresses. The cold prevents new blood flow, which brings with it fluid. The warm brings new blood flow that helps clear the edema that's already there. Antibiotic ointment is placed on the incisions. As long as you can see sutures, you should put some antibiotics on it. And with regard to physical activity, use common sense. Typically the first 1 to 2 weeks should be minimal physical activity because that raises your heart rate and blood pressure and can worsen your swelling and bruising. After the first couple of weeks, get back into physical activity slowly. And if your swelling worsens, it means you overdid it. Just be careful. The critical time for post-operative care is the first 3 to 4 days. Keep your head elevated, cold compresses, antibiotics on the incisions. Don't bend, don't raise your heart rate or blood pressure. We don't want to bleed. We don't want an infection. Thank you.